So we have another disease in the respiratory system that is very, very important. It is pneumonia. Okay. This pneumonia, this is very common and life-threatening disease, which is seen in the mostly old age peoples and in children also. Okay, what happened that every disease in respiratory system, you have to one common thing that it affects the tubules or it affects the alveoli. Okay, but the symptoms and most of the symptoms are common primarily, and secondly the causes are different. Okay, so this is the reason we will differentiate different with different names. So here pneumonia is it is also inflammation, but here inflammation is air sac. Okay, air sac will affect both the lungs or single lungs. So uh, most of the patients, most of the children who affected with lung diseases, respiratory diseases, first the right lung is affected. Later on, the left lung also affected. Okay, so the pneumonia is also seen in we have one pandemic that is COVID-19. So in that, pneumonia is one of the number of persons who suffer from pneumonia due to the bacteria. Okay. The alveoli sac, which is present in the lungs, is packed due to the bacteria, due to the virus. Here we have COVID-19 virus. So due to that, the respiratory tract infection is affected to the alveoli. So the air sac, which is the like bubble shape or balloon shape, okay, which is responsible for the diffusion of the air into the capillaries, from the capillaries to the blood vessels, from the blood vessels to the cell. Okay, it is packed. There is no entry for the air to pass through the bubble or balloon. Air sac, it is alveoli. Why this happening? Because of the virus, because of the bacterial infection. Okay, so here we have to understood that the reason behind the pneumonia is viral infection or bacterial infection. So mostly bacterial infection or environmental changes like wind, cold, rainy season, winter season, which affects and it produce bacteria, and the bacteria will affect the respiratory system. Okay, this is very important. So, what the type of symptoms you can see that? So what is the reason behind the pneumonia? Most of the causes are bacterial infection or viral infection. So what is the pneumonia? It is nothing but inflammation of air sac. So we studied that the bronchitis is inflammation of tubules, bronchial tubules. Here in pneumonia, the air sac is affected. So this is the difference between bronchitis and pneumonia. Okay. So what are the causes? Bacterial infection, viral infection. In electrohomeopathy, what can assume? We can assume that the person, because lungs are the important organs in the blood temperament. So here, blood temperament, weakness of blood temperament, blood temperament because it purify the bloods. The lungs are the purification area of the blood. So we think that there is a weakness in the blood temperament. So weakness of blood temperament is the cause of pneumonia. So here we have to put it, we have to improve the blood temperament, sanguine temperament or a sanguine temperament. Sanguine temperament. Okay. So this is the basic things we have to remember. Next thing is that what are the symptoms? Symptoms in respiratory system includes mostly the patient will have in the pneumonia because this is the bacterial infection. Okay. So patient have fever. Okay. Fever. One symptom of the respiratory system is cough with phlegm. Cough with phlegm. Okay. Another is or pus or sputum, cough with sputum. Okay. And fever. Fever is the another uh, symptoms of pneumonia, and chills also one of the symptom in the pneumonia. And we have another symptom if the pneumonia is widely spread, which is also seen in COVID-19, that is breathlessness, shortness of breath. Okay. So these are the 4 to 5 symptoms which tells us about the pneumonia. Okay. And another thing, if you auscultate, if you auscultate, what you will see in wheezing sound. Wheezing sound. Wheezing sound. Wheezing sound or crept sound. Crept sound. If you keep our stethoscope on the lungs, auscultate, you will listen the crept sounds. Okay, so these are the symptoms. Most of the symptoms are seen like that. If it is very problematic condition, also sometimes you need oxygen support. We will talk about the treatment plan. Okay, and it sometimes it is very serious. Pneumonia is very serious in infant. Okay, children. Okay, and some young children also. Young children's also, and mostly infant children, young children's, and younger, older people also. Older people also affected. So you have to see this case very carefully. Okay. So what is the reason? I already told you that the bacterial infection, viral infection, or weakness of sanguine temperament. Okay, in that bacterial infection, viral infection, the immunity is very weak. Here, blood temperament is the temperament of the patient or the person which is responsible to make the body in equilibrium or healthy level. It is weak, so you have to improve the blood temperament. So these are the things we have to remember while treating this children's or infants or older people or young children. Okay. And what are the examination we can do that? X-ray, basic X-ray is required. X-ray of chest. is always primary concern whenever you have uh, respiratory system diseases. If you are not cured more than 4 to 5 days, you have to go with the X-ray 5 days, 7 days. Okay. And sometimes sputum test you get for which type of bacteria or virus is infected. And you need basic CBP, ESR, and CR to see the inflammation and any infection of the body. Common. These are the common tests we had advice. And now treatment plan. So basically, in the pneumonia, sometimes the patient need oxygen support. You have to give oxygen support if the saturation levels are decreased below the 90. Some patients have 85 or 80 because the air sac is filled with bacteria. So the oxygen cannot pass through that if you give breathe normal breathing. So you have to give forcefully oxygen to the lungs. Then the lungs will absorb the oxygen and it will give to the capillaries, then blood vessels, then heart, then cell. Okay. So oxygen, in my opinion, you have to check the oxygen levels with the pulse oximetry. Pulse oximetry. Check the first whenever any respiratory disease patient come to your clinic, please check the oxygen levels. O2 level. Okay. With you have to examine with pulse oximetry. You have to keep with your you have to keep in your clinic pulse oximeter. Okay, this is the first examination you have to do. And second, the breathlessness. If the patient have breathlessness, also you have to keep the oxygen level. Okay, because temporary oxygen will help the patient to relax. Okay. Next, you need treatment of pneumonia. Nebulizer is very important. Nebulizer, because to clear the inflammation in the alveoli. Okay. Next, treatment. Next, medicine, remedies. So what are the nebulizer? What are the remedies? If most of the persons are children, so you have to pick up P3, C13, were 2, and infection is there. If it is more than 7 days, you have to add G. If it is acute, you have to B. Or else, first you have to keep one remedy, P3, C13, word to G. Or if it initial, don't add word to directly. You can add word 1. Okay. Okay. In word 1 or word 2, B or G. So you have to make 2 remedies, P3, C13, word 1, G, P3, C13, word 1, B. So first give nebulizer with GE remedy, next you give the remedy with B. Or else first B or secondary G. T3, 3, 2, 3, 3, 4, 4 times, minimum 4 times a day. In B5 or B4. This is the first thing I advise after oxygen. Next, remedies internally you can give according to the condition. Acute condition need very careful observation. Careful observation. Okay. Careful observation. Acute condition. Suddenly, what it may be happen. Some you need sometimes you need hospitalization also if the patient is not settled in your clinic. Okay, higher center, the auto sometimes. So careful observation is needed. And other remedies P1, C13, BE. Next is P1, P3, P3. And we have P2, C13, again B, and P3, C13, C5, no, C5, when one GE here, or sometimes it is, if older person, you have to need at P4. P4, C5, when one G. And other remedies, we can add S1W, means need to improve the immunity. If the patient have fever, we have to add F1, one, Y initial fever, you have the three moderate fever, or mild fever, moderate fever, or severe fever. Or in some cases, we need for the controlling of fever F1, S10, okay, one, YE, or WE. Okay, okay, a fever, chills, you need to cover the person with the blanket. Okay, and phlegm is there. Okay, nebulization will release the phlegm from the lungs. Okay, so you have to carefully treat the patient. All these are in D5 or D4, sometimes D6. Initially, one medicine you have to give D6 to calm down the effect of the disease. Okay, P1, C13B, or C17, F1Y. It is also a great remedy, C17, F1Y, D5. So these are the remedies according to the condition. We have to select and you have to treat the patient. So this is about pneumonia, very important. Most of the winter season and rainy season is affected with the pneumonia. So I hope you understood the lecture, this lecture. If anyone have any doubts, thank you.